drop off now, and you can watch it at another time. Okay, so welcome to the second session of our root cause analysis series. This is really the one where we're going to be talking about two common methods of root cause analysis, the 5 whys and fishbone diagrams. Today, your presenters are myself, Kristen Bigelow-Talbert, the Community Health Quality Manager at Bi-State Primary Care Association, and Joan Tulk, the Executive Director of the Community Health Access Network. Brittany Dolan also assisted us in the development of this series, but she's unable to join us today due to the Minnesota UDS training occurring. For today, our learning objectives are really to help prepare the federally qualified health centers for the performance analysis piece of their HRSA site visit requirements, but also for everyone to really gain a good understanding of the most common methods of root cause analysis. For our third session, we'll be talking about how to look at those root causes and use prioritization matrices in order to kind of identify which ones you should focus on. We'll also help staff develop action items for their site visits based on those root causes and how to sustain change within an organization, because that can often be a challenge. So those last 3 bullets are things that we're going to discuss in our third session, which will be next week. If you missed our first session, you can still access it. It was recorded, and it's available at the Bi-State Primary Care Association website. In that session, we talked about why root cause analysis is so important, what HRSA's expectations are for federally qualified health centers around the performance analysis component, and then how to develop strong problem statements, because these are really going to be essential as we go through the whole process. You can see a link here. We will distribute the PowerPoint at a later time, so you'll be able to access that then. So a question that I often hear from federally qualified health centers around this is, can't I just wait until my on-site visit? Because the HRSA reviewer said that we're going to be going over it at that time. And my answer is yes, but there are advantages to doing this ahead of time, a few of them. And so I really want you to take these into consideration to decide whether or not it's right for you. One of these is really that it's a lot easier to have open, honest, frank discussions around a table with your colleagues when you don't have an external individual there with you, especially somebody who's there to assess whether or not your health center is performing at a level that they expect. So it's much easier to have that open discussion about challenges you're seeing in processes, or when things aren't being entered where they should be, or X, Y, or Z. So that can be a real advantage, having this conversation ahead of time. Additionally, you have more time. You can take the time to really dive into it, to go down deep into the layers of the root cause analysis, instead of being limited by that hour or 2 that's put into the agenda. And believe it or not, when you dig into root cause, it can take some time because it can get quite complex, as we'll go over today. Additionally, one of the biggest benefits, at least from my perspective, is that you get to kind of steer your quality improvements. And that's because during the site visit, you'll need to decide on 3 action items during your site visit. These 3 quality improvement projects that you will be doing and reporting on throughout the next several months after your site visit. And by doing your root cause analysis ahead of time, you get to identify those root causes, figure out some solutions to them, and develop your action items ahead of time with your team's input, with knowing what resources you have available to you, being able to connect with your community stakeholders and partners to see if they would be willing to help you with X, Y, or Z, to gather some baseline data and make sure that the problem that you believe is there is actually a problem, and you're really able to give it some forethought and insight and make it a meaningful action item for your practice. Okay, so I always tell folks as we do root cause analysis that before you begin, you really need to build your parking lot. That's because it is human nature to jump to solutions, because as you go through this process, you will come up with ideas of, oh, we can just do this to solve this problem, or X, Y, or Z. And that's great. We want to capture that, but we want to capture it into the parking lot so we can come back to it later. The risk of putting solutions in your actual root cause analysis is that it can steer the root cause analysis in such a way that you could miss other root causes. So by all means, capture those ideas, but put them in a separate parking lot to go back to later. And that's really key, because it is so appealing to just jump to a solution as we go through this process. So it's going to be really essential to have this parking lot in place. And as you start, remember to start with your problem statements. As we discussed in the first session, starting with a strong problem statement really allows you to figure out, as you get to the solutions phase, if that solution will address the problem that you've identified. So starting with a strong problem statement is essential. And just a quick reminder about these, in your problem statement, do not blame people, but rather focus on processes, what the pain point is, what the problem is that you're seeing, and avoid pointing blame. So as you get started, it's really helpful to get your team together. And this could be a myriad of different folks. And these are some of the individuals I really recommend to be there. Assigning a facilitator can be really helpful to the process. I would suggest that this individual not be a key informant of the processes that you're going to be undercovering, because the facilitator needs to be asking the questions, but not giving the answers. And so if you have somebody who is a really key informant of the process that you're trying to kind of work through, then they're going to want to provide answers as well as asking the questions, and it can kind of throw the process off a bit. So assign a facilitator to it to help you guide through the process. It can make it much smoother. If at all possible, include your clinicians. They will be a key informant for many different root cause analysis pieces, because they can let you know what's going on in the exam rooms with their patients, what they're seeing. The quality improvement lead is important, because this is going to be ultimately leading to some quality improvement projects. And so involving them in the get-go can be really helpful. Don't forget about other folks that are involved in patient care, your MAs, your care coordinators, and other people who really touch the patient, because they can have some key insight that may otherwise be missed. And the same goes for your non-clinical folks. You could be surprised how much information your front desk staff, IT, and even your leadership can have about a certain problem that you may not otherwise have recognized. So I really recommend having a good team getting together, and as you go through this, it will really help to inform the process. Okay, so one thing that can be really helpful is if you have data to help inform your baseline to put into your problem statement. This can really tell you whether or not something you're seeing is a problem or not. That being said, as I mentioned in the first session, sometimes you know there's a problem because of what the data is showing you, And other times, it may be what you're seeing anecdotally. You may not be able to have the quantitative data that proves your point, but you know it's a problem due to observations from you and several other staff. And that's fine. Either way to start the root cause is perfectly acceptable. Data can help strengthen that argument if you have it available. So I recommend taking a look and seeing what's out there. Remember to look beyond your internal systems for data. There's lots of other data sources you can take advantage of. So now I'm going to jump into the 5 whys. This is one of the main tools that's used for root cause analysis and one of the 2 that we're going to cover today. So this sounds pretty simple because you just ask why 5 times. So it's really easy and straightforward and quick, right? That's how it sounds. This is essentially what it would look like in an ideal world. And here's an example of the 5 whys in order from the problem statement to the root cause. So asking why something is happening each time going down. So really simple, quick, linear, and you find the solution. Easy, right? Well, if you're doing the 5 whys thoroughly, it actually looks more like branches in a tree or a web. Because as each layer, you often have more than one answer to each why. And I encourage you to explore that before you just jump down to the next one, the next one, the next one. Ask, okay, what else? Are there any other reasons that we're seeing for this? So really kind of explore each layer and you'll get the most benefit of the root cause because you'll be able to identify many more things that are going on. This is a kind of a diagram showing how one question can lead to 2 and 3 and how it just kind of multiplies upon itself. So at the end, you'll find that you're asking why many more times. And this also can illustrate that it takes a lot more time than you might anticipate. If your root cause analysis with the 5 whys is simply 5 whys and is very linear, like that first diagram showed, that should tell you that you're missing something. That you're missing some of the root causes in some of the layers, because this often takes much more time than 5 or 10 minutes. So make sure you allot that time in your planning to do this. I've seen root causes where we've done it in 2 hours, and I've also done others that's taken more than 10 hours. So it can take some time, set it aside, it's worth it in the end. I also want to note that it seems like it's simple to just ask why, but crafting those why questions can actually be a little tricky at times. You want to make sure that your why question does not point blame at individuals. Rather, you really want to focus on the processes, the systems, and the barriers that you're seeing. And I'm going to go through a couple of examples to show how the answers can be different depending on how you ask that why question. So the question, if it's phrased as, why is Susan not following up on these referrals? You could get answers like, well, she's lazy or doesn't care, or she's too busy. So we want to avoid asking in this way, and perhaps instead try asking, why are the referrals not being followed up on? It's just phrased slightly different, still gets to the referrals piece, but the answers instead could come out as, well, there's no time set aside to do it, or it's difficult to track these in the EMR. So it gives you a different subset of answers than if you had just kind of pointed the blame at one individual. Another example could be, why is our CEO not providing leadership and resources to this when we see that it's important? And then again, the answers could be, well, they don't see it as being important. But if you try instead phrasing it as, why is this project, not a top priority for management? So more of identifying that it's not up there can get different answers, because right now, Matt and substance use disorder are taking a lot of time and resources. And I'm seeing this a lot at FQHCs across New England. So it's really a prominent piece. And if you really want to kind of simplify things a bit, you can simply ask, well, why did that happen? Or why did this occur? It's a more simple phrase. If you're a little uncertain about how to craft that why question, this is a more simple way to kind of phrase it to make it easier for folks. So then how do you know you're finally at the root? I mean, we've gone down several different layers. The piece about 5 whys is that sometimes you get to the root in 3 questions. Sometimes it's like 10 or 12. You can keep going until either you can't really dig down any further, or you notice that it starts to become cyclical. The answer to that question is really the piece that you just said above, and it just kind of keeps going in a circle. So those are 2 clues that you've reached the root for that particular thread. And remember, there are many roots that you'll identify in this process. You'll also notice, once you have all the roots kind of piecemealed out, that there are lots of categories that you can put these into. Some are human causes, like a misunderstanding. Some are physical causes, like not having your resources or tools, or even the physical environment being too small, the constraints, the layout. I've seen that as well. Organizational, so the culture or the processes and policies that are in place, or external pressures, so the cultural norms, federal policies and laws, and reporting requirements. So all kinds of things can fall into these categories. These are by no means the only categories that there are. And this actually leads us to our next root cause analysis method, which is called the cause and effect diagrams, which are also known as fishbone. And Joan is going to tell us more about those.
Hi, everyone. Hope you can all hear me. I am going to talk about the cause and effect diagrams, also known as fishbone diagrams, to help you in your quality improvement. As Kristen described in our first webinar and just now, it is critical to get to the true root cause of a problem before you begin trying solutions, as you are very likely to be solving the wrong problem. A fishbone diagram is a great way to elicit all the causes and contributing factors to a problem, and it'll be really useful as you work on a problem such as the high number of patients with diabetes whose A1C is over 9 or who have not had a test. Next slide. So why use a fishbone diagram? Well, often, just as Kristen just mentioned, there are many root causes and factors contributing to a problem. And the fishbone diagram just is a visual way to organize the list of causes and the relationships between them. And as a lot of people are more visual, it does help them to organize their thinking and see if they're missing anything. It categorizes them so you can determine what is and is not in your control. And it helps you get to the level of detail at which you can actually test a change, or change could be implemented. Just like the root cause analysis that Kristen described, the fishbone diagram process, it is very much a group process. And it's not only important that you have all the right people when you're doing the cause and effect diagram, but it actually, because you're doing the cause and effect diagram, I have found that it helps to really engage people into the quality improvement process. Again, you need to make sure that you have everyone in the group that influences the outcome. I've even seen teams bring in a patient in addition to those that Kristen listed earlier. And it's a very nice way, now that you've gotten to the level of detail and you know what's in your control and what's not, it's a really nice way then to lead into the next step of brainstorming and determining what changes you want to test first. Next slide. So this picture shows you, I guess, why we call it a fishbone diagram. This fishbone diagram, or the cause and effect diagram, was developed by Karo Ishikawa, who was an organizational theorist and was highly regarded for his quality innovations in Japan. He lived between 1915 and 1989. I'm not exactly sure when he developed this, but it's a testament to this tool that, here we are in 2018 and it's still highly recommended as a way to work on your quality improvement. Next slide, please. So you don't have to draw a beautiful picture of a fish. You just start basically by drawing at what would be the head of the fish as a box of what's the effect, what happened, or what didn't happen. What is the problem you're trying to solve? Then you draw a line, which is like the backbone of the fish, and then the fish bones going off of the backbone are your categories. And Kristen mentioned different categories that affect a root cause. And again, this is just a way to picture them. Next slide, please. So some common categories that people have used for those bones coming off the backbone, or the categories, are methods, machines, materials, manpower, etc. Often a simpler one that I've seen used more commonly is like place, procedure, people, policies. There is also a way to use a fishbone diagram where you organize those bones as functions or processes as opposed to categories of causes. So I see this less often, but it's just something to keep in the back of your mind. Say, for example, you're trying to figure out why is this patient not taking their medication? We don't have a very good rate of people with persistent asthma on a control medication. Why is that? Another way of grouping the fishbone diagram would say, okay, well, one category is prescribing. Why is it not being prescribed, and why not? Filling, is the patient not filling or the medication, or is it not being dispensed, or not being purchased, or taking the medication, and talk about all the things that surround a patient actually taking a medication. So that's just another way to look at doing a fishbone diagram that may be helpful in some scenarios, but is definitely not as common. It may be one that you want to use if you wanted to break out, say, two fishbone diagrams, two root cause analyses on, one, why are patients not getting their A1C tests done? And another one that's, why is their A1C still above 9? You might do two separate fishbone diagrams, and, the not getting the test done, you might want to use this function or process way of organizing your thinking. Next slide, please. So after you've drawn out your basic diagram, the bones, the skeleton, if you will, this is the point at which your team would start listing all the possible causes for each category. I found in facilitating these with folks, they often already have a list, and it actually helps with engagement and preparation for this if you do like a real brief survey with folks and ask them, what do they think are the barriers to a patient getting an A1C test, or the barriers to patients not being able to control their blood sugar, for example. So the team comes in with, somewhat prepared what to think about, what to talk about, and then you start putting them into your categories. And what I've also found, though, is that just putting up the different categories makes people think about things they would not have thought about before, like what is in the environment or in the community that's affecting a patient's ability, rather than just thinking about what happens in your health center or what happens with the individual patient. So it does help you sometimes to broaden your thinking about causes. Next slide, please. So this slide is a little bit busy. I apologize for that, but I think it shows a few important things. If you start in the bottom right-hand corner, you see it's describing that here's where you indicate the effect or the major contributing factor. And you may remember from the first session that Brittany talked about you listing your contributing factors. Sometimes these problems that you're trying to solve are so complex that it's really the contributing factor that you want to put at the head of the fish and work from there. Other times, especially if you're new at this, you might just want to start with the big problem, A1C not in control. Then in the top right, you see there's a lot of boxes coming off this branch that says human at the top, and a lot of them pointing to each other. This is a nice way to organize your 5 whys at this level. So say, again, the example of a patient not taking the medication might be the first thing. So it's a patient related cause. And then you would drill down into that. Well, why aren't they taking their medication? And, ask the 5 or 6 or 7 whys till you get to the real root cause of that and where you might be able to affect some change. This to the top left just shows again that they don't all line up nice and neatly. There's very often more than 1 or 2 causes for an issue that's going on. And a final reminder that these categories you can decide, as long as you feel like you're being comprehensive, that you decide what categories fit for your situation. Next slide, please. So here is no fancy pictures of fish or anything, but it's an actual example from one of our health centers in New Hampshire that serves a high population of homeless patients. And this fishbone diagram session was just one of many steps in the quality improvement process. And we did do a survey first to get people engaged and thinking about it. The team had representation from all the roles in this agency, and they came with their lists of what they thought were the causes, in this case for uncontrolled hypertension. We briefly broke into smaller groups and assigned people a category after we decided what categories. And a few people would then say, okay, we'll focus on everything we can think of that has to do with the patient. And some other small group was working on, well, what are the things that are related to the staff, etc. Here's a good point, I think, a good time rather to point out that you do this on a whiteboard, because you're going to be doing a lot of drawing and erasing and rewriting and moving from one category to another, making room for additional root causes underneath one cause, so that it is a very fluid and active process, and they're actually, I think, a lot of fun. On this picture, not all of the detail is documented here. What the group did was, after they drew it and were happy with it on the whiteboard, they took a picture of it. And this is just a Visio diagram of what I could remember from from their fishbone diagram session. So there were well, not obviously, but there were very many other causes and root causes underneath these that you see listed here. As I mentioned, they were working on reducing the percentage of their patients whose hypertension was uncontrolled. And you can see that they chose different categories from what we saw on the earlier slides. They have community, staff, patient, healthcare system. We weren't quite sure what to label that. And then, facilities, equipment, supplies. And this seemed to work really well for this group and this particular quality improvement project. So you can see under facilities and supplies, we had, well, all of the blood pressure cuffs don't fit. We don't have one extra large ones and extra small ones for all of our patients. And our exam room layout is not conducive to getting an accurate blood pressure from a patient because there's no room for them to sit and sit back and, rest their back, their feet, put their arm at the right level, etc. Instead, they're jumping up on an exam room table, So that was some of the examples of what fell into facilities and supplies. Whereas in staff, we said, well, it's probably a good time to make sure that everyone is measuring patients' blood pressure correctly. And having been through hypertension improvement a number of times, I'm always amazed at how much we all can learn or relearn or be reminded about that. They also talked about their workflow. Now you might say, well, doesn't workflow fit someplace else? But it kind of, it doesn't matter that much. To them, it was their staff workflow. By that, they meant, we're taking the blood pressure the first thing when the patient walks into the room. Maybe we can change our workflow so that we take their blood pressure towards the end of the check-in, the rooming process when the patient's had a few minutes to sit and rest, and their blood pressure comes to normal. So those are just some examples. Again, over here, patient, you might say, well, the patient doesn't have access to healthy food. Well, is that a patient issue or a community issue? We chose to leave it under patient. There was a lot of great talking about, well, why is it that they don't have access to healthy food? And this was one of areas that they did choose to focus on then. Although you might think that this is out of the health center's control, they actually did some great work, working with the soup kitchen, whatnot, drilling down into why the soup kitchen didn't have healthy food, etc. So as I mentioned, this process did lead to a great deal of engagement with the staff and led very nicely into the next session that we had, which was on brainstorming ideas, and it was at the right level, where they felt they could affect change, and again, where they couldn't. The next slide, please. And then finally, just to wrap up my portion and agreeing with what Kristen has said, there are often many root causes, and if you don't know where they're coming from or where they're going, if you don't get it organized, you'll never get to the real problem that needs to be solved. And I'm going to turn it back to Kristen.
Thank you, Joan. So one question you may be asking yourself, and one question I've heard before is, well, what's the difference between these two methods that we just presented on? And there are a couple of differences. As you saw, the fishbone diagram is broken down into categories, which can really help visually to see the connections and the different relationships between various root causes. So it's a way to kind of put some things in buckets and show how they're connected. And the 5 whys, it's a little bit easier to go into deeper levels simply because of the layout of the notes and of the structure. So they work really well together, and they're both valid root cause analysis tools. So using either one should get you to some root causes for your problem. So now you have, let's say, gone through the whole root cause analysis. You've figured out what your root causes are. You've identified them all. So now what? What do you do now that you have identified all of these different root causes? Because remember, with any one problem statement, there are usually many different root causes contributing to that problem statement. So now the next steps are really kind of prioritizing those root causes, figuring out which ones are in your control, coming up with solutions, and then turning them into quality improvement projects or action items. And that is exactly what we're going to talk about in our third session next week. So we're really going to be discussing how to prioritize root causes and give you some tools to be able to do that easily. Also discussing some ways to brainstorm solutions, some different methods that are out there, and then how to prioritize the solutions as well, because oftentimes you have many different ideas of how you could address a problem, but figuring out which ones are the most realistic given your resources, capacity, all that stuff. And then how to take those solutions and actually turn them into action items, into the plan, do, study, act cycles, which is a type of quality improvement documentation. I'm also going to be discussing how to really sustain that quality improvement and that change. This is something that is often a stumbling block for many organizations, is how do we keep this change? We want it to happen, but folks keep going back to their old ways. So how do we sustain it? So I'll give you some tips about how to really make sure that that happens. Next, you're going to see up on your screen, we're going to be administering a short poll just to help us get some information from you about this one. And also, it will tell us what we should be doing for our future trainings for you. So this is important information for us. We are definitely going to use it to inform any future opportunities for you. And now I really want to open it up for discussion and questions. Remember that you may be muted in 2 different places, on your phone itself as you called in and in the Zoom interface. So make sure you check both places if you would like to have some discussion. You can also use the chat function. We'll keep an eye on that. So now that we've given you all of this information, does anyone have any questions about how to go about this process or any other related questions? Have folks used either of these processes in your own health centers or other organizations? And what were your experiences like?
Hey, Chrissy.
Mm-hmm.
It's Heather. I've launched the poll, but nobody's filling it out. Can you see it?
Yep.
Okay. Please fill out the poll.
We had one person here, just fill it out.
Okay, great.
This is June. I did as well.
Okay, great.
Doesn't seem like when I hit the submit button, it goes.
Make sure you scroll down to, there's more questions than you can see when it first comes up. That happened to me first time too.
Ha. Long poll. Thank you. We have completed our first PDSA cycle of the call. Thank you very much. We'll keep that in mind.
So what are folks' experiences with doing the root cause analysis? Have any of you gone through the process yet in the past?
Kristen, this is June.
Hi.
We've done a lot of this with referral tracking, or
actually, with most anything we do, it seems to, the root cause seems to lead to resources and just staff time. Maybe it would be helpful at some point if we could have a presentation on time management, some tips or tricks to maybe help the others to find ways to work more efficiently.
That is a great suggestion and not one that was in the poll, so thank you very much. I'm writing that down.
That's one thing I work on.
Right.
That's my weakness. I don't have enough time. I'm sure that's the same with all of us.
I see it very often, so that does seem like it would be applicable for many folks. So thank you very much, June. That's
Sure.
really helpful feedback. Has anyone else experienced the same thing? All right, so I'm going to show you our contact information so that you can always reach out to us later. We are available to assist you kind of understanding this process and figuring it out for your own practices. For folks in Vermont, you can always contact me. Joan is a great resource for New Hampshire, and Brittany is also available for Minnesota and any other organizations. If you want to talk a little bit more about this, I'm happy to do so. I appreciate everyone joining us today. If you have not yet completed the poll, please do so. We really do use this information. So I appreciate it, and thank you for joining us today.
Thank you. Thank you all.
Thank you.